All right, hello everyone. This is my first attempt at making a YouTube video for our YouTube channel for Healthy Lymphatics. Healthy Lymphatics is our clinics. They are our clinics. We have 4 locations in North Carolina, 1 in Virginia, and 1 in Florida. And the reason I wanted to really make this channel is because there is so much misinformation out there about lymphedema, the lymphatic system, people who have swelling, what kind of swelling is it, how is it treated by different doctors and nurses, and of course it's 99% of the time mistreated, misdiagnosed, and the patients never get better. So I wanted to have this little channel to answer a lot of questions, and anybody can just message me underneath on the YouTube channel, and I will be more than happy to answer the questions on video. And I will also go ahead and answer a lot of questions that people have on Facebook, especially therapists. And it is very time consuming to keep going over and over and answering the same things, but through video, I think it's a little bit better. And a little bit of introduction about lymphedema. Lymphedema is a protein-rich fluid that causes swelling in a limb or in the trunk anywhere. People can get lymphedema pretty much anywhere on their bodies, including head, neck, trunk, back, abdomen, one arm, 2 arms, both legs, one leg. I've seen it everywhere. I've seen it where it could be just in the foot. It can be just in a calf, in a thigh, depending on the condition. So many different things cause lymphedema, and that is the main issue, that many of the things that cause lymphedema are never looked at as the cause for the lymphedema. The problem is that most people start seeing swelling. It starts very slow. As people age, especially, they believe that this is something normal, which is not, because you can have lymphedema at any age, at any time in your life, depending on what has happened to you. And the problem is, the main issue is that our lymphatic systems are comprised of lymph nodes and lymph vessels. So the problem is that we are all born with a different amount of lymph nodes and probably a different amount of lymph vessels, and that goes by the wayside because everybody just says, you know, my favorite question is, what percentage of people with breast cancer get lymphedema in their arm, get a swollen arm? My answer is always, I don't know. There is no number for that. You cannot do a study on 100 women with lymphedema and have it be conclusive and have it, once you repeat that study in a different 100 women, you will have a whole different percentage, because it all depends on what we start out with. So if somebody has 800 lymph nodes and somebody else has like 653, let's say, they can have the same things happen to them throughout their lifetime. And, you know, some people will get swelling, some people will not. It all depends how many lymph nodes are removed in the case of breast cancer. But I'll give you a really good example as to why I really wanted to go ahead and make this channel. And is, number one, to get people diagnosed properly by their physician. That is such a difficult thing to do, because I know lots of physicians that still really do not understand what lymphedema is, and they wind up sending a lot of patients our way, and we kind of have to determine if it really is lymphedema, if it is a mixed edema. Now we have something called lipedema, which I will get into later on. And so there are so many issues, and every patient, every person with lymphedema is just that one person. You cannot compare 2 people with lymphedema to each other. I have a daughter with autism. They always say that about kids with autism or people with autism. If you've met one person with autism, you've met one person with autism. It is the same thing for lymphedema. So, you know, it makes no difference. I could have 5 patients in one day with lymphedema. They are all very different. Their comorbidities are different. They, you know, of course, that means diagnoses. They have different issues going on. Their lymphedema could have started from a different reason. They could be at a different stage in their lymphedema. Some of them could have had it all their lives. Others could have just started, etc. So my favorite thing is, I get questions from a lot of my therapist friends that do not do lymphedema treatment. So I got one the other day, and it says, One of our nurses, this is inside a nursing home, tried to pick my brain about getting a patient, about a patient that's getting wrapped, and I said I would pick your brain instead, meaning mine. The patient has had wounds on her legs for 4 years, gushes lymphatic fluid, and just doesn't heal. So my friend that texted me this said that it sounds more like cellulitis because the woman never elevates her legs. So there are so many wrong things with that sentence alone. Number one, lymphedema is never cellulitis, and cellulitis is never lymphedema. Yes, people with lymphedema do get cellulitis, but cellulitis is an infection of the skin, of the tissues, that is treated with antibiotics, whether oral antibiotics or IV antibiotics. It just depends on how severe the cellulitis is. So again, cellulitis and lymphedema are not the same thing. I used to get a lot of referrals. I've been doing this for about 24 years. That would always say, Carmen for lymphedema treatment, or Carmen for cellulitis treatment, something like that. And that is not a real way to refer a patient, because number one, if you write cellulitis, I'm not going to treat cellulitis. I'm an occupational therapist, and I can't treat cellulitis with antibiotics. So I would still have to refer back to the physician and say, hey, this is cellulitis, we need antibiotics, and then we'll see if the swelling doesn't go down. It could be lymphedema. And with cellulitis and lymphedema, it's almost like which came first, the chicken or the egg. A lot of people have lymphedema and they can get several bouts of cellulitis over and over. Once people have lymphedema, so lymphedema is a protein-rich fluid. That protein comes from the oxygen exchange within a blood cell. Once the blood cell exchanges oxygen, protein molecules come out of the blood cell in order to allow for the oxygen to get where it's supposed to go. That's a very simplified version. And once that protein molecule is inside our tissues, it is up to the lymphatic system through lymph vessels to pick up that protein molecule. Therefore, the lymph fluid becomes protein. Now, that protein molecule has also picked up debris from our skin, from our tissues, especially if it's superficial. It picks up dead cells, cancer cells, whether active or inactive, water cells, any type of debris, people who get tattoos. The excess ink in the skin is picked up by the lymphatic system and becomes what we call a lymphatic load, which means there's just an extra thing that's attached to the protein molecule and to the protein fluid that our bodies has to get rid of. So with cellulitis, once somebody has cellulitis, or once they start getting cellulitis, what happens is bacterial cells get right into the skin. And once they do that, the skin itself becomes like a petri dish because it has a lot of protein, since the lymphatic system could not be working properly. And therefore, they do have some sort of lymphedema. It could just be starting. So those bacterial cells start attaching themselves and feeding off of that protein. So then the cellulitis starts spreading, and you see either red streaks, and usually if the patient goes to the emergency room, they'll take a Sharpie and make like marks around the red area to see if it spreads past the marks or not. Because the whole point is you do not want that infection to spread further up, to go all the way up into the trunk. Once it goes up into the trunk, it can actually go into the blood system, and then people get blood poisoning, or better known as septicemia. So we don't want that cellulitis to spread, and in somebody with lymphedema, it is very easily spread. So that's from that one sentence that I read, that's the discussion on the cellulitis. Now, the elevation is a whole other thing, because everybody that we see with lymphedema comes into the clinic and says, well, my doctor told me to put my legs up, and I've been laying down for months and nothing happens. Nothing happens because that is not treatment for lymphedema. Elevation does not do anything. You can literally hang these people upside down and you will never get rid of the lymphedema. Lymphedema is a breakdown somewhere of the lymphatic system, whether It's within lymph nodes removed, lymph nodes crushed through injury, lymph vessels cut through surgery, injury, or venous insufficiency where the person has poor circulation of the blood. So now you've got more blood sitting in the legs and more protein is being released because of that. And therefore the swelling gets worse. So there are many different things that cause lymphedema, and elevation does not do anything. So I usually tell my patients, please stop laying down. You're going to have to walk. And the best case scenario is for everybody to walk about 5 to 10 minutes for every 45 minutes that they've been sitting down. Whether they elevate or not makes no difference. That will not fix the lymphatic system. Nothing about elevation will give you back lymph nodes, lymph vessels, or will improve your circulation by any means, because once you stand up, that pressure in the blood goes right back down into the calves and nothing happens. I've actually had a patient that started hanging her arm on an IV pole at night, and that's how she was sleeping, because somebody said that if she elevates her arm, the swelling will go down. Well, it did not, obviously. So those are two things that, it's just crazy to me when people come in and they're like, well, I've been living on my back and I can't do anything because I'm so, now they're getting muscle atrophy, they're getting a whole other slew of issues that they do not need. So now back to my text. The patient apparently has had wounds, like we said, for 4 years, gushes lymphatic fluid, doesn't heal. So the nurse also said that they've been, quote unquote, wrapping this patient's legs for 4 years. Now, the problem with wrapping is that no wrapping is alike. Like, different bandages are different bandages. You can't use 20 different kinds of bandages to achieve one thing for which we have bandages. So in the world of lymphedema, the bandages that we use are called short stretch bandages. In most of the nursing homes and home health settings, they use ACE bandages or Una boots. An ACE bandage is the regular sports bandage that stretches about 175% of its original size. And once you put it on, if you use an ACE wrap, and you could be the best bandager, best wrapper on the planet, the ACE wrap, if the person just sits and doesn't move around, will get tighter and tighter and tighter, because now it's been stretched 175%, and that bandage wants to get back to where it started. Once the person starts walking, that bandage has more stress from the person's muscle pump action, and the bandage winds up falling off. So the ACE bandages have what we call a very high resting pressure and a very low working pressure. So when you're working, when you're moving around, the pressure is very low, bandage falls off. When you're laying down, it gets tighter and tighter and tighter. It causes a tourniquet. Most patients take it off and we're done. So then they have like a very tiny ankle or a very tiny arm somewhere, and everything else looks like a Popeye arm or leg. So what we use is short stretch bandages, still made in Germany to this day. And these bandages have a very high working pressure and a very low resting pressure, which means when somebody walks with the bandages on, the bandages work with our muscle pump action, and they continuously kind of massage the skin to continuously get rid of this lymph fluid. And when the person rests, they just sit there, they don't get tighter, they don't do anything. So with this case, and I will go more into detail later on, but with this case, especially with the open wounds, the treatment is completely wrong. And that is why this patient has had swelling and wounds for 4 years. I think I'm going to stop right here, and I will have a video going once a week. And like I said, if you guys want, you can ask me questions. I know this was not very explanatory. This is my first YouTube video ever. So I will go into more detail next week. Thank you.